Do you sometimes feel like you have stones in your eyes? Or are your eyes irritated or they just turn red? You could be having dry eyes. Join us right here as we discuss dry eyes. My name is Dr. Lucy of the Eye Clinic channel. In this channel, we teach you about eye diseases and eye conditions and where you can go for help. We also tell you some of the things you can do in the comfort of your home so that you can alleviate some of these symptoms. So before we start this discussion, let me tell you about tears and why we blink. On average, we blink about 20 times per minute. The blinking reflex distributes the tears in the same way that the wipers of a car distributes water on the windscreen when it is being washed or when it is raining. Blinking therefore keeps the eye surface smooth and clear. If there was no water, the windscreen would just get scratches from the movement of the wipers. And in the same way, if there are no tears, blinking would irritate the cornea and cause tears, irritation, and inability to see well. So our eyes basically need tears to stay healthy and comfortable. So if your eyes do not produce enough tears or tears of good quality, then you have what we call dry eyes. The tear is made up of 3 layers. We have an oily layer, a watery one, and then the innermost being the mucus layer. Each layer of the tear film serves its unique purpose and should be produced in the right quantity. The oily layer is the one which is most outside of the tear film, and it makes the tear surface smooth and keeps the eyes from drying up too quickly through evaporation. The watery layer is the middle of the tear film, and it makes the bulk of what we see as tears. This layer cleans the eyes, washes particles like sand, dust, all those things that do not belong to the eye. The mucus layer is the innermost, and this helps to spread the watery layer over the eye surface, keeping it moist. Without mucus, tears would not stick to the eye and would just run off. So if eyes are irritated, for example, when you're peeling some onions, our eyes make a lot of tears. But sometimes some people do not have enough tears, or something affects one or more of the tear films. In those cases, then we end up with dry eyes. So there are so many causes of dry eyes, but at this point, I'll just point 6 of the most notable ones because the list is quite long and we may not be able to exhaust. So number 1 is age and gender. So anybody who is above 40 years, most likely female, is susceptible to this. Not to say that men are not affected, but they are affected, but to a lesser extent. So then number 2, we have certain diseases that are autoimmune diseases, and examples of these are rheumatoid arthritis, thyroid disease, systemic lupus erythematosus. These are autoimmune diseases, and the way they behave, the pathophysiology of these diseases is a way people with dry eye syndrome would behave as well. So certain autoimmune diseases like rheumatoid arthritis, thyroid disease, and lupus erythematosus are more likely associated with patients who have dry eye syndrome. Then number 3, we have patients who are working in smoky, windy, or very dry climates, or a place where there is a lot of high humidity, are likely to suffer from dry eyes. Looking at a screen, computer screen or a phone screen, or just reading for a long time may reduce the blinking. As I said, we blink about 20 times in a minute, but this can reduce to as low as 4 times per minute if someone is busy on a screen or on a book. So you have to be purposeful when you're doing these things so that you keep your eyes moistened by just blinking. The other notable cause of dry eye syndrome is surgery, and especially refractive surgery, where people go for surgery just to stop wearing the glasses. So this is very common because after the first 1 week post-operatively, about 90% of patients will complain of dry eyes, and even after 1 month, more than half of the patients will still complain of dry eyes. About 60% of them will still complain that their eyes are dry. Of course, other surgeries, for example, due to poor lid closure, may also complain of dry eyes, but refractive surgery is the major complication of refractive surgery is dry eyes. And then finally, number 6, some of the medications for certain diseases, for example, diuretics for high blood pressure, some medications for heart problems, for allergy, for common colds, sleeping pills, anxiety, and antidepressant medications can also be associated with dry eye. So if you are taking some of these medications and you probably have these other comorbidities that we are talking about, for example, rheumatoid arthritis, thyroid disease, and you're probably 40 and maybe female, then you are most likely to have dry eye syndrome. So this also depends on the person that is having some of these things. Of course, there are many other causes of dry eyes, but I've just picked the first 6 causes of dry eye syndrome. Not to say that this is exhaustive. There's so much more that we haven't dealt with here. So how do you know that you have dry eyes? We have talked about so many causes of dry eyes, but sometimes it's difficult to know whether you have dry eyes or not. But as I started, I said that you could be feeling like you have sand or stones in the eye. That is one of the common feelings for people who have dry eyes, but you could also be having stinging or burning or just irritation, and the eyes are just turning red for no apparent reason, and your vision is not as good. You've been given glasses, but your vision is still not good enough. And then you get that feeling of you want to scratch the eyes. Is that gritty feeling? Sometimes you may even find that you have some mucus around the eyes that keeps on lingering around the eyes. You may have a paradoxical increase in the tears, and these are what we call reflex tears. They are not good quality tears because they do not have those 3 layers that we talked about, but you may have reflex tears. So once the doctor has already diagnosed that you have dry eye syndrome, so there are certain things that he will do. Of course, as we said, that he should be able to tell you that this is the quantity of the tears being produced, and this is where the problem is. It is this layer of the tear film that has a problem. So some of the treatments that he may institute is he may decide to give you drugs. And we have several types of drugs. For example, we have artificial tears that are safe and preservative free. We have ointments that are put at night because they blur the vision, so usually used at night. But there are also drugs that reduce eyelid inflammation, and those ones that control inflammation. So all those are drugs. But you may also have to put moisture chamber. It may give you moisture chambers, which are prosthetic devices coupled with eyeglasses that slow the evaporation of the tears from the ocular surface. And then number 3, we have special contact lenses that are worn. Special contact lenses that are worn to protect the surface of the eye and trap the moisture, and these are called bandage contact lenses. And then finally, we have surgery, which may be done if these treatments are not adequate. And plugs, and these are plugs that are inserted in your tear ducts so that your natural tears stay within the eyes for longer. And then, of course, finally, you need to treat or to manage the cause of this specific cause of dry eyes. So there are a few ways that you can actually prevent dry eyes at home, right in your own house, and I will just mention about four of them also. One of the things that you can do is warm compresses on the eye with a warm cloth or heated beaded mask, and apply to the eyes about 10 times. This actually clears the blocked oil glands. And then, of course, you can do massaging of your eyelids, and works the same way as warm compresses. Then cleaning of the eyelids, Then you have some supplements like omega-3. There are several studies that have been done to suggest that omega-3 can protect adult eyes from macular degeneration and dry eye syndrome. And then of course, if you're a person who likes reading and staring at books and computer, please practice the 20-20 rule. And the 20-20 rule means that if you're reading for about 20 minutes, then for every 20 minutes that you're reading, take about 20 seconds to lift your eyes off the book or that screen and look at something that is about 20 feet away. Just to know whether it is 20 feet away, just look at something that is a bit distant, a bit far, because it takes about 20 seconds for the eye to actually relax. That way you are able to reduce the fatigue as well as continue blinking, because as you are looking far, then it is possible that you'll be able to blink and therefore reduce the dry eyes. So that sums up today's episode on dry eyes. Do join us next week for another exciting episode on your eye health. Do subscribe so that we can alert you every time that we upload. Till next Tuesday, stay safe.